I want to take an opportunity to introduce you to the 3D Dentist Surgical Cassette and Kit. I have this saying that we need the right tools to do the right job at the right time. Because when we're working, part of being efficient is not having to search for items. And too often we're bagging things, we have little things here, little things there, and it's never just right. Or we get into having such a small kit and having to have multiple kits, or we get into trying to have everything perfect and end up with such a large kit. So I set out to develop a surgical instrument kit that would cover 80% of the dental surgeries that we're doing. Simple things like simply taking out a tooth, to taking out teeth, doing extraction and socket grafting, to surgical procedures just doing bone grafting, to a surgical procedure of taking out teeth and placing implants or just placing implants, or even as far as doing a full arch implant surgery. So that's a wide range of different items. And I'm really proud of what we've been able to create with the 3D Instruments surgical kit in collaboration with TBS Instruments. It's a single cassette that has all the different instruments that you need to do the vast majority of your surgical procedures in your practice. Now, does it have everything? Of course not. There's always going to be those instances where we need a few different things, but from decades of doing this in my own practice, we sat down and put together a kit that has almost everything you need for 80 to 90% of the surgeries that you're going to do. So what I'd like to do in this video is take the opportunity to walk you through exactly what's in this kit, talk you through kind of why we put these instruments together, specifically what these instruments do, and hopefully give you an idea of what's possible and what problems you can solve in your practice. So let's go ahead and begin. I think the first thing that's very nice is it's a cassette that has everything in it. You simply open it up, making it easy for your team members. They'll open it up and they open it just like so, and everything is there in a single cassette. Okay, so let's take a look at a very basic thing here. So we have a bar here that just clips right out, that holds the instruments in place. So why don't we start with the basic part of this? One of the basic things that we have is a mirror. Now, I know that sounds pretty simple, but it's a fantastic mirror. You can see the handle has good grips. It has a nice mirror, the standard cone socket. So if you have a specific mirror that you like to use in your practice, you can replace it. I know, for example, some of us like to use some of the high definition, high shine, high reflection mirrors. But one of the things that we designed and I really like in this particular mirror handle is that it has a measuring ruler on the end of it. I don't know about you, but when I'm doing implant surgeries or soft tissue surgery and you're trying to measure something, I hate looking for a ruler or having a ruler around. So now we can just use the end of the mirror handle and it will have everything that you need here. So for example, one of the most common things that I'm measuring is when I'm doing free-handed implant surgery, I'm measuring the depth of the implant. So I'll be able to put the drill on here, the osteotomy burr, and measure it to see how long it is. If we're doing a soft tissue graft, or if I pull out a big cyst or granulation tissue from an extraction socket, I can have something real quick to take a picture with or to measure it with there. So that's one of the most simple things that's in here that's been designed not just to be a mirror, but been designed to really be useful in practice. The next thing that's in here, again, that's again very simple but practical, is a probe explorer, but it's not your typical probe explorer. This is unlike a probe explorer that you would have in your restorative kit. In fact, the explorer portion of this is designed specifically to be quite thick. And the reason I designed it very thick is I'm not using this to look for decay and things like that. I'm using this to be able to feel the bone, so I don't want the flexibility with it, but I'm also using it to pull out Teflon tape and cotton from my implant access points. And I got very tired of my traditional explorers getting bent and pulling these out. So we designed and developed a much thicker explorer so that way we can pull the cotton pellets and Teflon out of the implant access sites. The other end of it, the quote unquote probe end of it, has two uses that we found when we're using it and developing it. First of all, it has millimeter increment measurements. So the first thing and main thing that this was designed for and that we're using it for in our practice is when we're doing implant osteotomies, I'm using this end of the instrument to feel the osteotomy, to make sure that there's bone all the way around, and to confirm the depth of the osteotomy, that we're not too deep or short in our osteotomy. The second aspect of it, we're using this as a bone plugger as well, especially when we're trying trying to fill our apical areas of our sockets and get good apical fill with our bone granules, we're using this to kind of help pack that area down, because it really does get down 10, 12, 15 millimeters into the socket and does do a good job of packing everything in there. So we have a probe explorer. The probe end is used mainly for implant osteotomy feel and also to help do some grafting as well. Now, the other thing that's unique in this kit is our blade handle. It is a blade handle, very similar to almost any blade handle that you've probably used before. The one difference in this is that we can release the blade by simply clicking on it like a ballpoint pen, making it easier for your team members not to cut themselves with a bloodied instrument or a bloody blade to protect them as well. So there's a hygienic and sterility component to that as well. We also have a Minnesota retractor in here. The Minnesota retractor, as you know, once you get into doing surgery, is helpful to retract lips and tissue and to keep your flap out of the way as well. So we do have a Minnesota retractor. You can use it on this end. You can also use it on the hook end to do your work there. So one last instrument here is I call it a cotton forceps, but I think the technical name for it is the Pritchard forceps. And we use this to grab cotton rolls, to grab things out of the mouth when we have little pieces of tooth break, or when we're doing things with small parts and pieces, always having it ready. We use this in the PRF world as well to pull our plug out of the tube. But we have a nice forceps here to be able to do that with. So now let's kind of move into the next realm, and that's if we're going to be laying a flap or reflecting flaps. There's two instruments that I want to focus on here. The first instrument is, I call this the reflector. It's technically has a Buser type instrument on one end and a periosteal on the other end. And I find that the Buser instrument is fantastic. It's very sharp, nice and pointed, and this does a great job of doing the initial reflection of getting the flap off the bone. And then, of course, we'll use the periosteal end to do our full thickness reflection all the way down. So this instrument was specifically designed and built to have something to get the initial part of the flap out and then doing the full reflection there as well. The second instrument for flap is a larger periosteal that has hollow holes in it. Sometimes we use it to pack bone so that we can get seepage through it. But this also is, again, as we're laying bigger flaps, we're using this to kind of dissect larger areas. And on the end of it, we have this paddle, which I like to use to kind of hold back my larger flaps. So again, very purposefully designed to be able to do some reflection and also do the flap reflection as well. And the combination of the two allows me and my assistant to both be able to reflect flaps when we're working in a critical area and we need good visualization. So that's why we have both of these instruments. Now let's take a look at the extraction side of things, what instruments we have in here. Of course, we have a straight elevator here. This is used, as always, to get initial flexing of the tooth and initial loosening of the tooth. I like to try to get as much of the tooth removed with this component itself, and it's a straight elevator. I don't have a large or a small. We kind of designed it to be a universal size elevator here. So that works, again, 80–90% of the time. There's no reason to have lots of excess instruments here. One instrument that I think is phenomenal is we have a Spade Elevatome here. Many of you guys have probably used instruments like that, and this functions in the same way. It has a nice handle, so you can hold it like so, and you can get leverage using the palm of your hand, but it has a straight spade end to it. And we're using this a lot to gain apical pressure, to really get down the PDL, to separate the PDL, and to be able to help use a wedge effect to get teeth out. I find this to be especially useful on canines and especially useful when we have teeth broken down to the gum line to be able to kind of get some pressure down midway down the tooth so that we can make removing the teeth easier. As we continue, we have our universal forceps. We have the 151, 150, and what's unique about these are a product called the Frings. And what they have is they have a spring built into them, so you're not trying to open it like this. I hate when I got instruments and I got to figure out how to open them. So now we have something that we can open, we can squeeze. It kind of really works nicely in your hands. And until you kind of really try it and see it and you do a few cases with it, you don't realize the real benefit of something so simple of having a nice spring to it and to try to preserve the bony structures around the tooth. And so there's a universal upper and lower, and these instruments again work fantastic to really take out teeth. Now again, in my practice, I find that between the combination of a elevator, an elevatome, and a simple upper and lower universal forceps, we're able to take out almost 95, 98% of the teeth in our practice. Now I know you might be thinking, hey, I need a cow horn. They do make cow horns and frings, but we're finding that we're not using them in our practice. Instead, we're sectioning the teeth and then using a combination of elevators, elevatome, and those forceps, the upper and lower universal forceps, and we're able to get the teeth out. Another instrument that we have here is a mini ronjour. Now this ronjour also has the springs built into it, so you don't have to manually open it up. That's really hard. I find that to be a pain when you're working in the back. And I wanted a mini ronjour because I use this a lot, sometimes to remove like the root tip fragments as they get loose, to be able to grab something, to have a little bit of force behind it, to be able to grab it really well. I also use this a lot to clean out granulation tissue and remnants of flap and not so nice tissue. So that's why I really want to have the mini end of this, because it works quite well in that situation. So I'm not using this like a traditional ronjour where we're using it to cut big pieces of bone, but we're using it to be able to cut small little areas of bone where we need things a little bit smoother, but mainly to get granulation tissue out and to be able to grab small parts and pieces in the mouth of tooth fragments as well. The next area that I'm going to move into while we're talking about extractions is we have a root pick elevator in here. It's a left and a right on a single instrument. So when you do break off teeth or you do need to get that little root out, especially on upper teeth and lower molars, typically where I'm finding it, you have an instrument that has a nice sharp edge to it that you can get into the socket and kind of tease those roots out and make it work quite well. So we do have a nice root pick elevator instrument here that has a mesial and distal end all on a single instrument. So that way you have it when you need it. And when you need it is when you absolutely need it, because nobody wants to be going around looking for those things. Also, when it comes to extraction time, one of the things that we always need when we're taking out teeth is we want to have a nice clean socket. We want to remove any PDL remnants there may be, certainly any granulation tissue, and nothing does that better than a nice curette, serrated curette in this particular case. It does a great job of removing all of that remnant granulation tissue, PDL, and really does a good job of cleaning that socket out quite nicely. And it's a nice size that gets into all the way down to the apex, even on your smaller molar socket as well. So that's one of the reasons we have that instrument there. The next instrument we have kind of when we're finishing up, now we're going to go ahead and do our sutures. And we put in a set of Castro needle holders. This was a little bit of an area where I initially wanted standard needle holders, but once I got used to using the Castros, the flexibility, the ability to do fine suturing, the ability to manipulate this and move it around in the posterior area of the mouth. And as you get into more complex surgeries, I find that the Castro needle holders are invaluable and great to do that. The other nice thing that I really love about these instruments, and this one in particular, is I don't know how many of you, as you're using needle holders and you're tying and you're trying to slip it through, your suture ends up getting caught right here in this little crease on the needle holders. And this crease is made so fine that when you're tying your suture, it really just comes through quite nicely and you're not getting caught on there. Fantastic, fantastic addition to the kit. Also, we went ahead and did Castro scissors as well. Again, for our assistants when they're doing cutting or when we're doing cutting, phenomenal instrument to gain access, to be able to see into the different areas, and nice sharp scissors that are able to cut and manipulate well. And again, all of the Castros, for those of you that haven't used it before, it'll take time to get used to it, probably a few cases, but once you use it, this will be one of those instruments that you'll never go back from. At least that's what I found in my own hands of using these kits. As we continue bone grafting, we have a bone scooper here. So a single instrument on one end has a bone scooper to grab your graft material, and then on the other end, a plugger to be able to compact it and plug it into the socket. So between this and my Explorer probe, we're able to do 95%, 98% of all our bone grafting procedures quite well. And I find that this also works really well with my PRF bone graft when we're going ahead and we're holding it down so my assistant can suction any any additional blood or juices that may be coming out of that bone grafting site. To round off our bone grafting, no bone grafting system is complete without having a bone grafting bowl. So we have that in here as well so that you can mix your bone, mix your PRF. And I want to mention, one of the things that was important to me was to have an instrument kit that we can also use for PRF. So I'm able to do all our PRF with this box as well, between the scissors, between the forceps to grab the PRF plug, between the paddle instrument here to grab some of the PRF and mix the bone around in here. All of this was designed to be very functional and multi-purpose in the kit. And last but not least, we have a syringe. I should have probably done this at the very beginning, but we got to have a syringe to numb up our patients and to have a nice syringe that fits well, that so far has not been turning brown and has held up to the test of time. That is very nice as well. We went through multiple iterations to get to this point. I know that if you put this into use, you will find it to have multi-purpose use in your practice, and it'll make your life easier. And at the end of the day, that's what everything's about. It's about having the right equipment, the right tools at the right time to get the right job done. And we're all after clinical excellence in an efficient manner. And this kit, I am very confident, fills that role, and you'll find it to be fantastic in the surgical side of your practice.